Is also active in Saudi Arabia, which is reporting more than 1,000 cases. The disease first broke out there in 2012. Shortly after, an epidemiologist from the Washington area was sent there to investigate the disease. Dr. Trish Perl talked with us about what she learned and how far we still have to go.
So the thing we learned in Saudi Arabia that's really most important was that actually basic infection control worked. So identifying cases early on, making sure that they were appropriately isolated, identifying contacts of cases, testing them if they developed even minimal symptoms, all of that worked. So this isn't really complicated. It just requires that kind of diligence and attention to detail. So I think that's the good news in all of this, is that we're not really requiring a really complicated technology. We know that this virus, in certain circumstances, can actually be transmitted between patients to healthcare workers, family members, etc. There are also cases in Saudi Arabia that are what we call community acquired. So they do not necessarily appear to be getting it from other people in the hospital. And the question remains, are these from other people who are infected and maybe have mild disease? Or is there a host, which we think there is. There's minimal data really about some of what we call sort of the genetics of the viruses and the change over time. There is some out there, but not as much as we really need to be. There haven't been correlates between what our clinical observations are and actually sort of more structured studies to really look at the epidemiology. What are the true risk factors? What are the things that are happening in these hospitals that cause people to transmit? One of the very unique things that we're seeing in Korea has been the emergence of people who seem to transmit to multiple people. Well, there was at least one example in the outbreak we investigated of that, and it was certainly well described in SARS, but we need to really understand what are the characteristics of these people. We essentially know nothing about treatment of this disease. One of the very sad things we don't talk about with SARS is that we treated people early on with steroids that seemed to increase their mortality. And so it's really a huge scientific responsibility to make sure that when you have diseases like this, that you look at therapy to make sure that you are at least not doing harm. And so, it's a big black box about what should we be doing. We could potentially see a MERS cousin, or we may see, a more virulent MERS or something emerge. So I think it has that potential, that possibility. We have a responsibility to really have a global response. And, I think that's one of the things that hopefully will come out of this, is that we need to harness the scientific and public health communities